Good afternoon, doctors, ladies and gentlemen. My name is David Tan from Vanguard Aesthetics. I bid you a warm good afternoon welcome to Vanguard Zimmer's ZLipo 360 webinar. Allow me this afternoon to introduce to you our speaker. We are very honored to have with us this afternoon, Dr. Sylvia Ramirez. Dr. Sylvia is a Harvard-trained US board-certified medical director of Cutis medical laser clinics. Dr. Sylvia is a pediatric nephrologist by training, completing her clinical training at Harvard Hospital Systems. She has an MPH from Harvard School of Public Health and MBA from University of Chicago, both graduating with honors. She has served as vice president of an international think tank and led a 25-country clinical research study evaluating the outcomes of dialysis in multiple countries. She has served as an Asia-Pacific Regional Medical Director of Davita, one of the largest dialysis companies in the world. She has published numerous papers in international peer-reviewed journals and book chapters and has spoken at top international conferences in the field of nephrology. She completed a degree in dermatology from Cardiff University and graduated with distinction at Anglia Ruskin University in the UK with a Master's of Facial Aesthetics. She is now beginning to publish in the field of non-invasive facial aesthetics, having recently published a paper examining predictors of proceeding with non-invasive facial aesthetic treatments in a multi-ethnic population. Ladies and gentlemen, during the presentation, all attendees are in view-only mode. Please type in your questions in the Q&A section and we will answer them at the end of the presentation. So without further ado, I have great pleasure to introduce to you Dr. Sylvia Ramirez. Good afternoon to you, ma'am. The floor is yours. Thank you.
Thank you for that introduction. And I want to thank everybody for joining us this afternoon. I know this is in the middle of your day, but I hope that I can give you additional insights on cryolipolysis, especially with the ZLipo system. As mentioned, I'm a nephrologist and an epidemiologist. I'm now focusing mainly on aesthetics, having done degrees in dermatology and facial aesthetics. And with that circular background, I hope I can give you a little bit of a different intake or insight on cryolipolysis. So what I'm going to do is first, after an introduction, focus on the cryolipolysis mechanism of action. We look together at some of the clinical studies and then spend the last half of the presentation focusing on the ZLipo system, in particular in combination with the treatments that we do, and I'll show you those treatments later. To begin with, I should say that this is the first slide we show our patients, that we always make it clear that non-invasive body contouring procedures do not replace diet and exercise. It requires a healthy diet and regular exercise in order to achieve health and well-being, as we know. Exercise, for example, we call it the most powerful pill because it has a lot of benefits as shown in hundreds of clinical studies. And so, for example, it improves our mental health, but also chronic diseases, whether it's cancer, cardiovascular disease, and of course, our physical fitness and our physical appearance. This is why patients come to us. What about the stubborn fat that is resistant to diet and exercise? And I should say to begin with that we know that there are two places where the fat deposits. The first is immediately under the skin. This is called subcutaneous fat, and of course that is the pinchable fat that is the target of our non-invasive procedures, body contouring procedures, but also of liposuction. On the other hand, if you look here, this is the visceral fat. It surrounds our internal organs, especially in the abdomen, and that is most pertinent for increasing our insulin resistance, also leading us to a chronic inflammatory state, and such as with diabetes, even Alzheimer's disease, and that is not treatable with our body contouring procedures. So you can see in these images the characteristic presentation. The man on the left has this classic pinchable fat that is ideal for our body contouring procedures. The individual on the right has this classic globular, really distended, very hard abdomen that requires a true overhaul of lifestyle, diet, and exercise, and sometimes adjunctive medications. And so we know our target is subcutaneous, so it is this fat here. And surrounding it are the skin and the muscles and other really important tissues. We need to take advantage then of the difference in the freezing point of the fat layer as compared to the other surrounding tissues. And I'll talk about that more later. I should say that underneath the fat is this muscle layer in red. This we can do treatments, and I'll talk about that later, using electromagnetic muscle stimulation, because that has been shown also to improve the appearance of our features. Before focusing on cryolipolysis, there are, of course, other non-invasive fat reduction methods. And what I'm showing you here is a systematic review that looks at the top 4 methods, and this is from 2015. I should say that typically when you look at individual studies, it's very difficult to come to a meaningful conclusion as to the effectiveness of a procedure, because you need then to look at the other studies, and systematic reviews do that for us. It tries to pick the best designed clinical studies and look at the various results related to those procedures. The top 4 procedures then, you have cryolipolysis. There are, of course, multiple brands. There's Cool Sculpting, Cool Tech, and what we're going to discuss today, which is ZLipo. There's low-level laser therapy. An example there is Zerona. HIFU is liposonics. Radiofrequency would be examples like Vanquish and TrueSculpt. And all of them cause an efflux of triglycerides, resulting in first shrinkage of cells. That's what you see with LLLT. You have necrosis of the fat cells with HIFU, and you have apoptosis with radiofrequency, and of course, cryolipolysis. I pulled some of the pertinent data from this systematic review. We're looking for example, at the reduction of the circumference of the abdomen. And you can see that by far, it is cryolipolysis that achieves the greatest reduction. So 6.9 centimeters to me is quite impressive. It doesn't say in this review how many treatments were done, but nevertheless, it achieves the greatest circumferential reduction. The second is LLLT. I'm just going to go back, but you could see that LLLT, it is a wide range of effectiveness. And the reason is it is thought that the way it works is it causes the opening of pores in the adipocytes, and there is then shrinkage of the fat cell, but you're not reducing the number of fat cells. And so if you look at the procedure like that, the best results are in the first 4 weeks, and then by 12 weeks, it seems there's a bit of a rebound or regrowth of the adipocyte tissue. HIFU and radiofrequency then follow. When you look at circumferential reduction of the thigh area, it seems that cryolipolysis again leads the way, particularly in combination with shockwave. And I'll talk about this combination later on. Again, the same pattern. This is followed by LLLT, HIFU, then radiofrequency. But then when we turn to patient satisfaction, it seems that cryolipolysis again is the most, yields the highest patient satisfaction at 80 to 100%. Radiofrequency is also quite high, and that is a little bit interesting because radiofrequency, as you can see in the other columns, does not generate as great a reduction. That is probably because when we look at patient satisfaction, it's not just the circumferential reduction, but we're also looking at the patient experience, such as side effects or adverse effects and the sensation of the procedure. I should point out that HIFU, there are numerous studies that show satisfaction below 60%. But because of this, you can see why cryolipolysis has become the top body contouring method non-invasively, because of it has achieved the greatest circumferential reduction, but also the highest patient satisfaction. So that is the focus of our presentation today. So how does it work? Well, as it turns out, by the time we're in our young adult, we have a set number of fat cells. That is, unless we gain and become obese, gain weight and become obese, and then there's a slight increase in the number of adipocytes. When we lose weight, each adipocyte shrinks. When we gain weight again, each adipocyte grows. And that explains the yo-yo result of exercise and diet. In contrast, when you reduce the number of fat cells through a procedure such as cryolipolysis, you have a permanent reduction of the fat cells in the treated area. And even if you put on weight, the remaining adipocytes may grow, but that area remains relatively streamlined as compared to the untreated areas. What happens to the fat? Cryolipolysis takes advantage of the differential cold sensitivity of the fat cells as compared to the surrounding tissues. In particular, the triglycerides in the fat cells have a freezing temperature of about 10 degrees centigrade, whereas the water in the muscle, the skin, and the nerves don't freeze until -5 degrees centigrade. So there is this 15-degree difference. And so as you apply the cold with cryolipolysis, the fat cells undergo apoptosis. Apoptosis, you may recall, is really part of our physiology. It's a physiologic process by which our body eliminates cells in an effective and harmless way. So for example, in our developmental differentiation, some of our cells are apoptosed. When we have trauma, some of the cells are apoptosed. Or even when we are trying to get rid of worn out cells, and apoptosis reduces the risk of malignant transformation. And so apoptosis is a natural, orderly, and gradual process. The cell membrane of the fat cell stays intact, and because of that, there is less risk of scar tissue formation. In contrast, on the right, necrosis is what you could see, for example, with a procedure like HIFU, and it's thought to be more of a traumatic and disorganized cell death with a greater risk of scar tissue formation. We actually don't know the precise mechanism of action of cryolipolysis, but what we know is as follows. The first, we apply a vacuum, we apply cold, this extracts heat. It is then becoming similar to what we call cold ischemic injury. The cells go through a cascade of events. First is cellular edema. There's reduced activity of a very important cation exchange pump known as the sodium-potassium ATPase pump. There is reduction of the ATP, or the energy available to our cells. There is buildup of lactic acidosis and free radical formation, and the cells go through apoptosis. I should say that when we remove the handpiece of the cryolipolysis device, there is reperfusion and blood flows back. And that is thought to further enhance the injury to the adipocytes because of the circulation then of the free radicals. So after that, apoptosis happens within the first 2 or 3 days. Thereafter, our inflammatory cells come in. You can see the little dots here, and they take away the apoptosed adipocytes. And this continues up to 4 months. There is then fat layer reduction, and there's some fibrosis that you see to replace the fat cells. And so the original study documenting the effectiveness of cryolipolysis was by Manstein and colleagues in 2008. So you can see this is really just a procedure that's a bit over 10 years. And there is still much we can learn and much we can improve about cryolipolysis. This is in pig study. Pigs, and what they showed was when they apply cold of a certain temperature, there was a reduction by several millimeters of the treated fat. On biopsy, they see lobular panniculitis or fat inflammation. And of course, over time, there was loss of subcutaneous fat. And there was, more importantly, no damage to the surrounding tissues. And here is from another study by Marmol a couple of years ago. What it showed is that the normal, here you can see a normal histology of the adipocyte tissue. They are kissing each other almost, this hexagonal structures. You can also see the nuclei are typically squeezed or collapsed here. And within a couple of days after cryolipolysis, you see these multiple dots. This is representing the influx of inflammatory cells. You're beginning to see the adipocyte tissue being disorganized. And here you can see on the image, and the arrow here is the fragmentation of the fat cell nuclei. And so this documents the cell death. This shows you and proves that it is apoptosis. So this is the normal fat cell. When it is stained 2 to 3 days later by a specific stain against an enzyme called caspase 3 and brown, and this caspase 3, I should say, is known as the executioner cell, because it is critical to the apoptosis process. It coordinates the entire apoptosis process. So when it is present, apoptosis is present. And that you can see within 2 or 3 days after the treatment. You can see the other stained apoptosed cells here. What about the clinical evidence? So I should say that there are hundreds of clinical papers since 2008. thousands of patients treated in clinical studies. And the studies conclude that there is consistent fat layer reduction with high patient satisfaction, without trauma to the surrounding tissues, without increase in triglycerides or cholesterol levels. So let's look at some of these. One of the biggest is from 2013. This is in 518 patients. It's one of the biggest and one of the earliest. And it showed caliper reduction of 23%. So this is a typical finding when we do our cryolipolysis procedure, especially in this area, the abdomen, back, and flank, where the authors also found the greatest and most important improvement in fat reduction. And so it is the midsection. And 82% of the patients in this study would recommend the procedure to friends and family. So just with this study alone, it tells you first how effective it is and how popular the procedure is. Now we turn to the largest systematic review. This is from 2015. There's not much published since then. I should say that is this big. These authors looked at 319 articles, but in the final analysis only included 19, so they considered only 19 as well designed. In summary, their analysis showed an average fat reduction of between 15 to about 28% when you measure by caliper, a little bit less than that by ultrasound. So this is what we say to our patients: expect a 15 to 25% reduction in the fat pocket that is treated. And really, we cannot tell who responds 15%, who responds 25%. We cannot tell which individual and with which area. But all of the studies showed fat reduction in every area examined with high satisfaction rates. And I'll talk about lipid levels and liver function tests shortly. So this is their key finding. This is divided by areas of treatment. The largest of them is abdominal area, the largest in terms of sample size. But you can see in the second column that the patient number across the board is small. The largest is actually an abdominal treatment by Sasaki's group in 2014. That showed about a 27% reduction. I want to point out there's a wide variation, because if you look then at this study, this was the first treatment with 4.5 centimeter reduction. They achieved a 15% reduction only. But nevertheless, going down here, that number I mentioned, 15 to 25%, sometimes 28%. This is, of course, in the petroconteric or the hip area, but there is wide variation, but in all areas, it seems to be effective. One of the questions our patients ask then is, which area gives us the best result? And so this is a recent analysis published last year. I should say that this is by no means comprehensive. This really only looked at a handful of studies as listed down here, one of which is the Cool Sculpting Patient Safety Information. But if you look here, these are the various areas, typically looking at 1 or at most 3 treatments in the flank area. Follow-up is a minimum of 3 months. The fourth column, percentage correctly identified, just means that when an investigator is showed 2 pictures, they can say which is before and which is after. The most pertinent would be the last 2. And you can see here the ultrasound results showed a range of between 1.9 to about 3.2 millimeters. The greatest reduction seemed to be in the arms, second with the inner thigh, so where the fat is a little bit softer. I should say, but again, that this is not conclusive. You can see that the flank area, unfortunately, it was presented as a % rather than a millimeter reduction, so it's difficult to compare, but that is achieves a 19% reduction, which is a pretty meaningful result. Patient satisfaction is shown here. Again, the inner thigh achieves the best. Surprisingly, the outer thigh seems to be very responsive in this study. In our experience, the outer thigh is quite challenging, especially amongst the Asian patients where the tissue is quite fibrous and hard. You can see the upper arm, although it yielded the biggest reduction of -3, this is from the Carruthers study, patient satisfaction was 63%. And this may be because if you've ever had cryolipolysis, you know that the arm area is one of the more uncomfortable areas for the procedure. So it shows you here, all areas, it is effective to varying degrees. Then what about Asian? So our Asian, we see, I should say, we see about 50–60% Caucasians, and the rest are Asian patients. And the vast majority of studies on cryolipolysis are in Caucasian patients. This is the largest study I could find for Asians, and this is in South Korean patients in 2019. I should say that South Korean patients, of course, are different than other Asian patients, including Singaporean patients and others. But what you can see here, again, different areas in the first column, fat thickness reduction by caliper in the second. First, you can see the numbers are a little bit different than the one I just showed you. We're showing at least twice, if not 3 times, the quantum of reduction that I just presented. So I find that quite interesting. But nevertheless, it just proves that in all areas amongst Asians, it is similarly effective, if not more. There are differences in effectiveness, depends on area to area and person to person because of differences in fibrosity of the fat, so the cytoarchitecture, the vascularity, and also the local metabolism of the fat cell. And so it is not conclusive that one area is better than the other. These are the two coming up, the two classic studies that show safety. The first is by Coleman looking at long-term nerve injury. And the reason we look at this is because if you have done cryolipolysis, you know that numbness is a very common side effect, and it's been reported in about 6 out of 9 participants in this study. So it's approximately 2/3 of patients. And it seemed that the numbness can last up to 4 weeks. And so it was important to document that there was no change in the nerve fiber structure, and that's what you see here. The top column shows you the control group, and what's important would be the green lines, the epidermal nerve fibers that's responsible for our skin sensation. You can see that 6 weeks after cryolipolysis, the same green lines are intact. The other important classic study in terms of safety is looking at the impact of the procedure on lipid levels and liver function, because of course we're manipulating adipocytes, they're processed, there is shrinkage of the cell, they're taken away for clearance through the liver and lymphatic system. And so in this study by Klein and others, you can see the impact on cholesterol on the top panel and the impact on AST or liver enzyme, particular liver enzyme on the lower panel. The x-axis is weeks post-treatment. The red dashed lines are the normal ranges. And you can see there is no meaningful change in terms of whether the cholesterol level or the liver function test. So that just reinforces the safety of the procedure. A lot of our patients, of course, find us because they are thinking about cryolipolysis over liposuction. I should say, though, that this is not a replacement for liposuction. However, our patients recognize that liposuction may be associated with complications. And one of the biggest studies I read of about 2,400 patients, this is by Kim and others in 2011, so 2,400 patients, they identified a side effect rate of 8.6%. So 1 out of 12 patients will have a significant adverse event. The most common was contour irregularity. So the area that was treated was not smooth, it was lumpy. And in another study, I saw that this issue of contour irregularity is so significant post-liposuction that up to 10% of patients may need a second surgical procedure. There are, of course, other side effects. There's bruising, there's swelling, there's prolonged downtime. But also there are some life-threatening complications with liposuction, albeit rare, such as pulmonary embolism. For those reasons, liposuction has declined over time. It's reduced by 30% from the year 2000 to the present time. And this is one of the reasons why non-invasive body contouring has become the top fastest growing aesthetic procedure in the world. So with that, we like to look at cryolipolysis. Generally, it's better for patients who are not obese. It is very difficult to achieve meaningful fat reduction if a person is not doing lifestyle changes and if their body mass index is 30 or greater. So we tell them that it's very unlikely for them to achieve significant fat reduction if their fat pockets are quite large. The second, mild to moderate skin laxity. And the reason is if this is severe, often I'll suggest that they consider surgery to tighten the skin, like a tummy tuck. But Also, I should say that there are other treatments we can do to tighten the skin after cryolipolysis. Of course, comorbidities that makes a patient a poor candidate for liposuction, we would think more about cryolipolysis. It doesn't mean that it's safe though. So we still want to assess the patient. Body areas that are associated with high risk of contour irregularity. So the smaller areas, the more visible areas, such as the arms, the knees. So we always face this. In fact, we have a couple of patients post-liposuction that we have had to do cryolipolysis and other procedures like shockwave in order to blend the contour irregularities. Also very important to consider cryolipolysis over liposuction when there's a desire to avoid scarring in very visible areas, particularly for Asians where we have a higher risk of keloid formation. We have at least one patient who has keloids, very clear marks for where she has liposuction. And so this is leaning then towards cryolipolysis. And of course, the desire to avoid downtime. So then when we look at cryolipolysis, and we know that in some instances, in the majority of instances, patients may favor it over liposuction. But what are the relative and absolute contraindications? And you learn more about this as you're doing the procedure. But generally speaking, if you have an extreme sensitivity to cold, such as paroxysmal cold hemoglobinuria, you would probably think twice before subjecting them electively to a cold procedure. If there's impaired circulation or neuropathic disorders, particularly in the treatment area, you want to think twice. For example, if you don't have intact nerve sensation and you have numbness, you're never really going to know that the sensation has restored back after cryolipolysis. Bleeding disorders or use of blood thinners can increase the risk of bruising, but that is a relative contraindication. Obviously, if there are active skin lesions in the area to be treated, you want to think twice and treat those rashes before doing cryolipolysis. And then pregnancy or lactation. And finally, hernia or diastasis recti, because the vacuum suction of cryolipolysis may potentially worsen those issues. Generally, this procedure has a very, very low side effect profile. The most common are listed on top: erythema, bruising, swelling, sensitivity, and pain. So this is actually from that same systematic review by Ingarjola. These are the multiple studies that they included in their systematic review, the number of patients, and you can see that expect redness, expect erythema in 100% of patients for a few days to a week. Bruising in about 10%, but in the study at the bottom here, it was up to 23%. So typically it is petechiae unless they are on a blood thinner. So it's not the big bruising actually, and it recovers fairly quickly. Swelling again is an almost expected phenomenon. You can see it for 2 or 3 days. Varying degrees of sensitivity should be expected. This can be anything from decreased sensation. You see here, this study, although it's small, 73% had numbness at 3 weeks, and even at 2 months, 18% still reported this. Then the last shows you the varying degrees of discomfort. This, of course, depends on the patient. But I should point out here that there is what's called delayed pain with cryolipolysis. This is 2.5% of patients reported discomfort at the treatment site, even at a week after the procedure. So, but generally, very, very mild, reversible side effects. The one side effect we want to educate our patients and spend time discussing is this. Paradoxical adipose hyperplasia is a local increase in adipose tissue that generally presents at 4 to 5 months, but up to a year post-treatment. So actually you see a patient, they respond to cryolipolysis, and then the fat cell, the fat area slowly grows. This is a characteristic image. You can see a sharply demarcated, homogeneous fat mass that is firm, following the shape of the handpiece. I should say there is no unifying risk factor. We used to be told this is in males of Latin American origin. That is not the case. It can happen in all areas, and the exact pathogenesis is not known, but is thought to be linked to handpiece and the characteristics of a handpiece, because the brand in which this has been seen, which is Cool Sculpting, when they changed the design of the handpiece, there was a significant reduction in incidence of PAH. And so what is paradoxical adipose hyperplasia? When we look histologically, We report lobular panniculitis, there's white cell inflammatory infiltration, areas of focal fat necrosis, and disorganized fibrosis. And the incidence rate reported by the manufacturer of the device of which this is linked reports it as 0.025%. This is still what we are told. But in fact, a more recent study, this is a Canadian study, Nicholas last year, they showed that this can occur in up to 0.39% or 1 in 256 cycles. They observed this in all areas, both men and women, regardless of race and ethnic group. So it happened also, of course, this is a Canadian study, for the most part, they are Caucasian, so 78% Caucasian. In no instance was there spontaneous resolution. They needed surgery. And I should say there was one patient that they tried another cryolipolysis treatment that did not respond. So here you have a patient who's trying to avoid surgery that responds to cryolipolysis, then over time develops this condition, and now you tell them they need surgery again. And so this is something that patients should be aware of, as can happen. I should say that this has been reported only with cool sculpting and more commonly with their older handpieces. It's not been reported with other cryolipolysis devices, does not mean that it cannot happen. And I should note that the manufacturer is currently in a class action lawsuit because of thousands of what they report as thousands of cases in the United States. And I should say also there is at least one study by Michon this year that showed that doing shockwave immediately after treatment, which we do anyway, we do massage, we're told to do massage after treatment to improve effectiveness. But in our case, we've been doing shockwave, not just to improve effectiveness, but because of the theoretical reduction in risk of PAH. I'll talk about that more later. So now I'm going to focus on the ZLipo and the ZLipo 360 handpieces. We are a body contouring clinic, just like many of you. We have many devices. We have the other cryolipolysis device that's cool sculpting. We have radiofrequency devices. We have shockwaves. We have electromagnetic muscle stimulation. But the ZLipo system is our go-to device because of the following reasons. The first, all systems have two pieces in one go. So you don't need to purchase a second machine in order to do two treatments in one. You don't need to buy a new machine with two handpieces in one. This is the baseline system of the ZLipo system. There are no treatment cards or expensive consumables, and this is very important because then it reduces the cost to the patient because it reduces the cost to us. The first generation handpieces of the ZLipo system are deep and large with two cooling end plates at the side. So we're going to say, hey, wait a second, that sounds like the original cool sculpting handpiece, but there are two differences with the ZLipo system. The first, it pre-massages. And so it pre-massages very fibrous tissues, very fibrous fat tissues. And so something that is very firm, it softens. And it's then able to achieve greater suctioning ability and therefore greater outcomes. More importantly, it post-massages. So built into the cycle is an actual very strong massage. You can change the strength of it. It improves the outcomes. We know that massage improves the outcomes after cryolipolysis because it breaks additional adipocytes. It enhances recovery, and there is this potential of reducing the paradoxical adipose hyperplasia. And I'll show you later, you can also customize the treatment settings with the ZLipo system. The old handpieces are on the right. You don't see the depth of it, but they're very deep, very large. The new ZLipo handpieces are on the left. So they're called 360. I'll show you why in the next few slides. I was saying earlier to the team that typically when we assess a patient for body contouring, we often combine devices. It's very rare that a person only needs one. Sometimes we use a different cryolipolysis device for a softer, smaller area, and use the ZLipo system for hard areas like the flanks, the hips, the banana roll, the thighs, because of the pre-massage, post-massage capability. But with the new ZLipo 360 system, you can see why it expands our ability to treat patients of different sizes of fat pockets because of the smaller size, the different sizes that we have now been added to with these 3 additional 360 handpieces. The cooling in the 360, this is why it's called 360, is homogeneous throughout the entire cup. So it gives us a more effective, more even cooling. In fact, as you can see in the last bullet, as a result of that, from a 1 hour treatment, we only need 35 minutes to achieve a better result. And the vacuum is distributed throughout the entire handpiece, so it's actually a much more comfortable procedure. You hardly feel the vacuum. These are just some of the images. You can see the cooling panel is all around this handpiece, and the same with the two body handpieces, as you can see here. And the image here is a classic placement. There is, of course, a gel pack that is very essential for skin safety. This allows us, as I said, the treatment of all the following areas that you see here. And using the ZLipo system, which again does not really have meaningful consumables with the exception of the gel pack. This is the appearance of the screen. Now you can see very clearly that there is the ability to treat the left with a different setting. If you wanted to customize the setting to the right, because many of us are asymmetric in terms of our fat pocket distribution. Dual, if you're turning on both handpieces. This is the default setting for the 360. It's 35 minutes with a certain degree of suction. The baseline is -5 degrees at 35 minutes. I should say that unless you're very experienced with cryolipolysis, there is a reason this is the default setting. This is the safest setting, but it is also effective. And so try not to manipulate. Now, I will say that in the vast majority of our patients, we do combination procedures. So this is what I'm going to discuss today, because we combine cryolipolysis or ZLipo and even co-sculpting with these devices. So the first I'm going to talk about is Z-Wave. Z-Wave is a shockwave. Shockwave, of course, has been used in rehabilitation and urologic indication. It has a long history of medical indications. It only uses pulsating air. For our purposes, shockwave results in additional mechanical and biochemical lipolysis. In fact, on its own, it can reduce fat. It remodels fibrous tissue, so it's really great for fibrous, hard tissues, but also for cellulite, where you can get lumpy fat. There is improvement in blood flow, so it enhances recovery, reduces also free radical buildup. There is a lymphatic drainage effect. It drains and washes out toxins. And so we use this device routinely after cryolipolysis. We are told, of course, to do massage. So I've taken this image from Dr. Xie. A massage using the hand is on the right. You can see that it's trying to knead it in order to blend it, improve the outcomes also. It's been shown to improve a little bit the results of cryolipolysis, whereas if you administer shockwave, you can achieve a much greater kneading and much more profound softening of that tissue and potentially additional fat pocket destruction. We use it also for contour irregularity. So for example, remember I told you it's anywhere from 15 to 25%, but we have seen patients who respond beyond the 25%. And so it creates a depression, which is unattractive and unnatural. And so we use the shockwave to blend it so that the transition is smoother and more attractive. This is a study that shows the combination of cryolipolysis with shockwave therapy. It is a small study. And you can see here on the x-axis would be the weeks after the cryolipolysis procedure. On the y-axis is the percentage fat reduction. And the bottom graph, the gray, the dotted gray, is cryolipolysis with the initial hand massage, whereas cryolipolysis with 4 weekly shockwave treatments is the orange line. And you can see every week there is at least a doubling of the effectiveness of cryolipolysis when combined with a Z-Wave procedure. So in fact, in Michon's study, he showed even greater patient satisfaction when cryolipolysis was combined with a Z-Wave. And the Z-Wave has been shown to increase the incidence of adipocyte death after cryolipolysis. So this is an earlier study. So in itself, it increases fat cell death, as we know. It reduces swelling and discomfort because of improving recovery. And it has an anti-fibrosclerotic effect and decreases oxidative stress in the tissue, and therefore may reduce panniculitis associated with BAH. So in fact, we have been doing it routinely And I will say that since we have been combining Z-wave with cryolipolysis, we have not seen PAH. The other important device that we combine with is this one, the Z-field. And this is electromagnetic muscle stimulation. This triggers an action potential in the motor nerve so the muscle contracts. What's very important, as contrasted with the older neuroelectrical stimulation devices, is that there's no coupling with the skin. So you're not triggering the dermal epidermal nerves. And you can then have very powerful contractions without the discomfort and the skin sensitivity and pain associated with the older neuroelectrical stimulation devices. So this is a classic result where you can see the buttock area is become more pronounced, and that then lifts the banana roll and the legs look more streamlined. We use the Z field on its own for all of these areas. We have athletes doing Z field. We have very fit individual doing Z field. We have ballerinas doing Z field in order to create a tilt in their lower back. And there's one study that shows the benefit of electromagnetic, so Z field in combination with cryolipolysis. This is a publication from last year. You can see here the various treatment protocols, so electromagnetic stimulation alone, cryolipolysis alone, and the two in combination versus circumferential reduction in the abdomen. And you can see the combination therapy increases the effectiveness of cryolipolysis by 50%. And so we have a protocol that combines these two. Furthermore, when looking at patient satisfaction on the right graph, you can see the same 50% increase in patient satisfaction about their figures with the combination of cryolipolysis and electromagnetic muscle stimulation. As you can see, this is, of course, an early study, and the numbers are fairly small. We have cryolipolysis, radiofrequency shockwave, electromagnetic muscle stimulation, so Z-wave, Z-field, Z-wave, Z-field, and of course ZLipo. We have Vanquish, we have Axilis, we have cool sculpting. And when we assess a patient, we like to look at what gives them the best outcome, because many patients will need a combination. It's never just the fat that bothers us, especially in patients above 30 years of age. Of course, safety is key, but we also look at the lowest number of treatments, because that is, of course, important to our patients and for us to make our patients happy. And so we like to look at how best we can combine them. And so that is why the expansion of the ZLipo handpieces with the addition of the smaller ZLipo 360 that can take different body areas, we're able to then overall reduce the cost to the patient, because these procedures to us, we administer them at lower cost than our other cryolipolysis device. I'm just going to run through some examples of before and after. And obviously, each patient can take on more procedures. I'm just going to show you examples here. And this is the abdomen, flank, flank. These are thighs. So to me, thighs are actually the most challenging, especially among women. As women, our estrogen makes it more resistant, the thigh fat and hips more resistant to fat cell destruction. And so to be able to achieve something like this with the ZLipo system is very rewarding. And the same here, this is inner thigh and outer thigh. The submental area, this is of course with the ZLipo 360 mini. And so you can make a meaningful difference, very obvious difference in the jawline. And this is one of our patients in combination with Z-field and cryolipolysis. And this is just an arm to show you the ability to taper and tailor the arms as well. In summary, we always develop a customized treatment plan when we do a body assessment. The availability of multiple handpieces of the ZLipo system allows us to treat all areas now of concern. I should say that no single treatment addresses all body concerns and goals, and in the vast majority of cases, we often combine with the Z-wave and the Z-field. And so with that, I thank you for your attention, and I am open to questions.
Thank you very much, Dr. Ramirez, for that beautiful presentation, amazing results that you have obtained. Ladies and gentlemen, we are actually now into the Q&A session. And with that, I would like to introduce to you today our moderator, my colleague, Dr. Malini. Where are you, Dr. Malini? Hi, Dr. Malini.
Yeah.
So
Hello.
Dr. Malini will be moderating the questions together with Dr. Sylvia. So I'll hand the stage over to Dr. Malini and Dr. Sylvia.
Okay, thank you, David. So thank you, Dr. Sylvia. That was a very good descriptive presentation explaining the whole process of cryolipolysis in body contouring and fat reduction. And I like how you explained the trinity combination of ZLipo and ZField and Shockwave. So we go to our first question for today. So first question would be, could you please share with us your experience as a user and an observation for patient results in using the 360 handpiece compared to the first generation ZLipo?
I will say that the first generation handpiece was very good, especially for large, very fibrous areas like the thighs, like what I showed you earlier. I would envision that the 360 is going to be able to reduce the discomfort associated with the strong vacuum and suctioning, and because of the need for massage with the older handpiece, whereas the 360 no longer needs this massaging. It is shallower, but because the cooling panel is all around, it probably will create a more streamlined, smoother response as compared to the older device. But I should tell you that the older device we will continue to use for very large, difficult to treat areas that could benefit from both the pre and the post massaging. So I would think that it only expands our ability to treat the full needs of a patient who is looking for body contouring.
Okay. All right, so the next question was on PAH in cryolipolysis. So you've mentioned actually the combination with Shockwave. So could you explain just briefly on the treatment protocol again when you combine a 360 with to avoid such incidents?
Yes, so I will tell you that we have had one case of PAH. This gentleman had a flank treatment, and this was about 5 years ago. This was using the legacy cool sculpting handpiece. And at that time, all we were doing after the procedure was hand massage. And when we turned that patient over to the manufacturer because they helped us manage the patient because that requires liposuction. But since that point, I have been very, very cautious of doing a treatment that can increase the risk of PAH. As I mentioned earlier, it is devastating for a patient to then say you need surgery. And this is why the class action lawsuit in the United States, and this is not just of patients, but also providers. So when I was looking after that patient, I was looking for ways to minimize this. First of all, I know that the new handpiece, whether it's the ZLipo 360 or the new cool sculpting handpiece, would potentially have less risk because they've shown that, but it can still happen and it's still been reported with a cool sculpting new handpiece. But I thought, how can I reduce this? And when I search and look, and with the little literature that I could find, including the ones I discussed here, it was only Shockwave that has been shown to potentially reduce the risk of PAH after cryolipolysis based on this theoretical anti-fibrous sclerotic effect. And so we started to incorporate Z-Wave after every cryolipolysis, regardless of device. Even if it's cool sculpting, we do it. If it's Z-Wave, Z-Field, ZLipo, we do it. And so as a routine, we do it right after instead of a hand massage. And then we offer to a patient, we show them that slide I showed you, where you have an almost doubling of result with a combination of Shockwave with Z-Wave. And we offer to them this opportunity to enhance the result by combining with a Shockwave therapy. But as a routine, we do it with every patient, with every cryolipolysis, without additional charge. This is part of their procedure, with the exception of the submental area because it's much too tender, and the chest area when we're treating gynecomastia. It's much too sensitive for those areas. But as a routine, we always do the Z-Wave.
Okay, so when we talk about combination therapy, when you combine the ZLipo with the Shockwave, could you explain what is your frequency of treatments? How often do you do it? And if you were to combine the Z-Field, how long later would you add the Z-Field into your protocol?
So by default, I would say shockwave right after, so the Z wave right after. If they are open to adding the Z wave additionally, such as what I showed you, this is once a week, they would come back for it. So it allows us then to enhance recovery. And we do a series of 4 weekly treatments with a shockwave, with a Z wave. In that study, I showed you that combined Z field with cryolipolysis. That particular study, the protocol showed that after they do cryolipolysis, they do the Z field 4 sessions within a 2-week period, every 48 hours at the soonest. Yeah, so after cryolipolysis, they will then do the Z field a minimum of 48 hours later, and every 48 hours thereafter for a total of 4 in 2 weeks. But that is not what we do, because we actually have patients who come to us almost once a week. And let's say after cryolipolysis, the most important, I would say, is the shockwave. And then we would often combine the Z field and the shockwave together. In the end, it really depends on their tolerance to discomfort. And immediately after cryolipolysis, it's quite uncomfortable, especially if they're swollen, they have delayed pain. It's quite uncomfortable to do the shockwave, but there's no issue about it. We tell them this improves your recovery, so you have to do it. So even if they come and they have focal panniculitis, the hard nodular fat that you see sometimes even after radiofrequency, we shockwave that, we blend it, because we believe that that reduces the risk of that turning into sclerosis and improves the recovery. So my answer to you is, we tailor it to what the patient can tolerate in terms of frequency of visits, in terms of discomfort.
All right. So we're talking about the 360 handpiece. How much fat tissue do you think should be inside when you put the 360? We're talking about how many percentage?
Oh, you mean in terms of reduction?
Yes.
Okay, so I would probably say it's still going, I would tell a patient it's still between 15 to 25%. The suctioning is less, so you're taking less volume than the other handpiece, the old handpiece of ZLipo, which remains to be very strong in my view. So it doesn't replace to me the old handpieces. To me, it adds to what I can treat. So I can better treat, for example, the softer areas, the arms, for example, because you don't need much suction. The softer abdomen, if the abdomen has more localized fat tissue. If it's a lard tissue, I would still use the old ZLipo, for example. And if it's very hard and fibrous, I would still shockwave before, do the cryolipolysis with ZLipo, and shockwave again after. So we do it all the time. So we actually call the shockwave as our secret weapon, because it allows us to treat a wide variety of things. It allows the cryolipolysis to be a safer procedure with less discomfort afterwards, with the recovery being faster. We use it for cellulite, for blending. We use it all the time, I should say, the shockwave.
Okay. Okay, so there's been a few questions asking on how can you, because they have the first generation ZLipo, and can they convert to the second generation? So I think that one, you actually can contact your sales representative, and we will actually guide you towards how you can convert it to the second generation handpiece. Okay.
I will just answer to that, Dr. Malini, that
yes.
In my view, you don't want to convert, you want to add.
Correct.
Because it's for a different application. So it's still, as I mentioned earlier, when we assess a patient, we look and see, okay, what is the best design treatment for this patient? And the reason we have 2 devices, and the reason we now are very happy that with the ZLipo 360 is I like to use the least number of cycles in order to achieve the greatest effect. So I don't want to use many small cycles if I can use a bigger one that then takes a larger volume. So for thighs, for sure, there's nothing that matches that powerful pre-massage, post-massage with the old ZLipo handpiece.
Okay. So, okay, we're running out of time. So we're going to get to our last question. Okay, So if I understand you have many cryolipolysis devices in your practice, so could you give us a summary of how this has done a good advantage of using the current 360 in your practice today?
Yeah, as I mentioned earlier, there's strong advantages of the ZLipo system in general in that you're using 2 handpieces in one. I know the other brand is coming up with a device that has 2 handpieces, but I should say in the United States that has just been recalled for whatever issues. And so the 2 handpieces in one, the fact that there's no consumable, when we discuss with a patient, the cost to the patient is much lower with any ZLipo treatment because there's no cartridge. And the 360 then allows us to cover all areas very well without the need then to turn to the other device. And so ZLipo has become our only go-to device for cryolipolysis unless a patient seeks treatment with a cool sculpting device. So ZLipo is what we offer. This is to the patient less expensive. So we actually compare prices when it's ZLipo versus the other brand. And we explain to them that it's because there's this expensive consumable. So it reduces their cost to the patient significantly using the ZLipo system, regardless of new or old handpiece.
Okay, thank you. So David?
Yes, Dr. Sylvia, time flies when you're actually having fun, right? 1 hour just went by just like that. But thank you so much for such a enlightening afternoon. I really learned a lot, and thank you very much for your patience and generosity. So I would also like to take the opportunity to thank all our attendees today for taking a time out from their busy schedule to join us for this webinar. If you do have any questions that we weren't able to answer during this session, please just reach out to us. We are always here to be of service to each and every one of you doctors. And then we will endeavor to get those questions pushed to Dr. Sylvia, and then we will come back to you with answers. So nothing else, but thank you so much for everyone's attendance. Thank you, Dr. Sylvia, for your time this afternoon. All of you, please stay safe until we see everyone in person again. Good afternoon. Bye-bye.
Thank you, everybody. Thank you for the chance to speak. Thank you.
Thank you. Bye-bye.